Global HIV leaders meet in Kigali to tackle treatment, prevention, and funding challenges. This week, Rwanda is hosting the world at the International AIDS Society Scientific Conference 2025. Researchers, advocates, global health leaders, and people living with HIV have gathered in Kigali to discuss the future of HIV treatment, prevention, and funding. This is the Comment TV News, where facts meet impact. In today's special report, we bring you exclusive coverage from the International AIDS Society Scientific Conference happening right here in Kigali. This is not just any conference, it's the IAS Scientific Conference, held every 2 years. The focus here is on innovation in science, new HIV prevention tools, and how research shapes national policies and services.
So my name is Florence Riako Anam. I am one of the 2 co-executive directors at the Global Network of People Living with HIV. We are an organization that is led for and by people living with HIV, and we work to promote local for global people living with HIV-led advocacy to ensure our treatment access and to ensure we stay alive, because for people living with HIV to stay alive, we need our treatment. But because we also have progress in science, we now know that people living with HIV, when they are tested early and started on treatment in a timely manner, then they can be able to live healthy and quality lives. But the additional component of this and the benefit of treatment is then people living with HIV who get to viral suppression cannot pass HIV to someone else. This week, GNP Plus and all the other people living with HIV leaders from across the world are joining scientists, governments, ministries of health, and other global leaders in the International AIDS Society Scientific Conference, hosted by Rwanda. And we are excited to be here, first to eat isombe, but mostly to come together to look at what is the progress in science. Where there is progress in science, how does that science turn into policy at the global level that can be adapted at the country level, that can then lead to resources, programming, service delivery, planning, and activities that then ensure people living with HIV, people who need HIV prevention, people who need services are able to get it in a proper and responsive manner.
One of the big announcements this year comes from the World Health Organization. WHO is releasing new global guidelines for HIV, hepatitis, and STI treatment, aiming to improve integrated service delivery and care.
This is the scientific conference, so this conference is mostly about sharing new innovative science, and there's a lot that is happening in this particular science. I'm happy to share a little bit of that as well. But mostly also it's the opportunity that World Health Organizations, for instance, use to share recommendations for normative guidance. So on Monday, tomorrow, World Health Organization will be sharing the new guidelines on HIV treatment, for treatment of HIV, hepatitis, and STIs. So there's graduated treatment recommendations, new treatment medications, treatment medication options for children, service delivery options, integrated service. So this will be usually done at the global level, and then countries then adopt them, and then they're adopted into the health facility.
There is also optimism around new tools. A new injectable HIV prevention drug, Lenacapavir, approved by the FDA, offers protection with just 2 doses a year, a game changer for people at risk.
In this particular scientific conference is news that just happened, I think last week but one, with a new HIV prevention product that was developed by Gilead and has now been approved by the FDA and is available for use, called Lenacapavir. So it's an injectable treatment, 2 doses a year, that someone who is at risk of getting HIV or acquiring HIV can be able to take to prevent HIV. So this is the kind of progress in science that we have now. And if we make sure that people are able to to access these tools and prevention opportunities, then we are really on our way to ending HIV, closing the tap of new infections and ending new HIV infections. We know now if someone is started on treatment early, they can live well quality lives, they can live better, and they won't pass the virus. So that is also another way of ending new infections and stopping AIDS deaths. So it's a different space. There's lots of new scientific or other developed scientific opportunities that will be discussed here. Opportunities of better diagnostics. I think one of the other key WHO recommendations will be for the use of a dual product for stopping HIV transmission and stopping pregnancies. So these are tools that are good for particularly young and adolescent girls who are finding themselves in difficult situations and needing to have practical conversations around pregnancies, or anyone who's needing to have conversations around timed and planned pregnancies, but also preventing HIV, which continues, particularly for Africa, to be a big, big problem for particularly adolescent girls and young women aged 15 to 24.
Youth voices are also rising strong at this year's conference. Gerald Kimo, a youth advocate from Kenya, says it's time to put communities at the center of HIV research and programming.
My name is Gerald Kimo. I am the Executive Director of a youth-led organization called Ambassador for Youth and Adolescent Reproductive Health Program that is IREP Kenya, and I work in the response. Being here today in the beautiful Kigali, my third time here, I'm excited because I'm here to do two things. One, to represent the voices of adolescents and young people, not only from my country, but in the sub-Saharan Africa, the voices of young people in this space, specifically on HIV research and development. The IAS is majorly a research and scientific conference, and for the longest time, it's been assumed that young people, communities don't have really the space and the opportunity to be in rooms where scientific stuff and research conversations are happening, but we are here to actually change that narrative and to tell scientists and developers and companies and organizations that are dealing with research that the voices of communities, particularly young people who are majorly affected by HIV, is important when developing a product, when thinking about a program, especially in this day and age where we've seen shifts in funding cuts, where we've seen programs being taken away. It is important that the young people's voices are here. So I'm here to really represent that voice.
But beneath the energy and innovation, there's concern. Major donors are cutting back on HIV funding. Many fear the progress made could be reversed.
But secondly is to help the globe and different partners and colleagues to think about the most innovative ways of moving forward. With the funding cuts, we've seen a lot of programs being stopped and halted, and it ideally means we need to rethink our strategy. We need to think about how do we do more with lesser money, which is opposite of what used to happen before January. So I'm here to think about, to help think with colleagues about innovative ideas, think about how best to ensure that young people are retained on treatment, that the new products like Lenacapavir are able to be accessed, but most importantly that the voices of communities and young people are very loud when it comes to HIV research and development. Is to ensure that our governments actually do something. For the longest time we have been dependent, and someone entered the State House and decided it was time for us to think for ourselves and fund our own health. And I do agree, it is time and it is important and it is essential. So for me, is to really think through about how, as countries in East Africa, in Africa, how do we push our governments to really actually allocate resources to fund HIV, TB, and even malaria. It's essential, it is necessary more than ever. The other thing is to think about programs by the community, led by the community, thought through by the community, programs that will actually address some of the gaps we are seeing. Today we are joining the Global Network of People Living with HIV, and we're talking about advanced HIV disease.
Rwanda's own leaders in the HIV response are taking this moment to reflect and adapt. Dr. Deo Mutambuka from RRP Plus says the country is shifting to more targeted and community-centered care.
This IAS conference gathering here that is happening here in Kigali, it is an opportunity for people living with HIV, opportunity for the researchers, opportunity for the advocacy organizations, international and local organizations, and we see it as a great opportunity for really rethink, re-strategize, and do things differently. And matter of fact, as the Rwandan community network of people living with HIV, we believe that Rwanda has been in a transition. We have fought for different issues, and we still be positive that this one will be also in a collaboration between RRP Plus, government agencies, and donors will be really sit and drive a better change that is community-centered, whereby better services are being delivered. We are no longer, we reduce roster follow-ups, those who are no longer attending appointments, and we are thinking about how to reshape the strategies of responding to the HIV adverse disease. Then, with this aspect or context, we need to strategize and respond accordingly, case by case, than doing it as general. That's what I would compliment in terms of the question, and vis-a-vis the opportunities Rwanda hosting IAS 2025.
UNAIDS recently reported that over 630,000 people living with HIV died of AIDS-related causes last year. Many of these deaths were preventable, linked to stigma, treatment fatigue, or late diagnosis.
As people living with HIV, to particularly talk about advanced HIV disease, which is which is AIDS from its definition. But UNAIDS released the Global AIDS Report on 10th, and on there 630,000 people living with HIV died of AIDS. And they die usually from diseases you can prevent, like TB, like meningitis, like diarrhea, severe bacterial infection. These diseases can be detected and prevented. But we know that because HIV is a unique disease, there's lots of stigma. Most people delay to come to the hospital or don't take their treatment, or taking treatment for the rest of your life is also hard, particularly if you were born with HIV, now you're in your 30s. So most people stop because they are tired. So people acquire AIDS and then they die. So we are here to talk about this, share knowledge and information, and then as people living with HIV, do our best to secure our colleagues. Particularly now, the disruption in January, many of us, because of the misinformation, stopped going to the facility or don't know what to do because there's change. So we want to try and get all of us back on treatment, all of us to enjoy the benefits of HIV science, and all of us to stay alive, because we really should stay alive. It's unacceptable for people to die when there's opportunity to stay alive.
Rwanda is moving toward the 95-95-95 targets, a UNAIDS strategy to end AIDS by 2030. The goal is 95% of people living with HIV know their status. 95% of those diagnosed receive sustained treatment. And 95% of those on treatment achieve viral suppression. Rwanda is close, but funding and innovation is still continued. Dr. Deo Mutambuka, Executive Secretary of Rwanda's Network of People Living with HIV, RRP+, add that HIV is no longer a death sentence, but only if science, funding, and policy move together, with new prevention tools like Lenacapavir, updated WHO guidelines, and strong advocacy from youth and communities, the end of AIDS is possible. But it requires urgent action, political will, and the belief that every life matters. As the 5-day event continues, the message from Kigali is clear. Progress in science must reach everyone, especially the most vulnerable. For the global HIV community, this is not just about research, it's about survival. From Kigali, this is the Comment TV reporting on the International AIDS Society Scientific Conference 2025, where science, solidarity, and action unite, which is held in Kigali from 13 to 17 July 2025.